Why do some people's butts itch so bad at night? That's actually a really good question. Suspicious blue veins, taller people have more trouble breathing, and should you be more concerned about itchy butts at night? What? Today, I'm answering some of the dumbest, weirdest, and surprisingly important medical questions that people have a lot of misconceptions about. Some of these will make you laugh, others might make you a little uncomfortable, and all of them will make you think twice. All right, let's dive right in. First question, how do you get someone's blood pressure if they don't have arms?
What did you say?
Blood pressure is basically the pressure within our arterial system, our blood system, which then leads to this question of, if I don't have arms, where do we check it? You can check it on your legs. Typically, we do it on like the lower part of your legs. You can do your calf or your thigh. You just have to be aware that those readings tend to be a tiny bit higher than what you would get on your arms. And there is another option. We can do something called an A line. An A line is a peripheral line that we would put in an artery that we can actually measure pressures on continuously. That'd be another option for us. Dumb question. Why do doctors make me say ah when I go see them? What on earth are they looking for?
Say ah.
When we ask you to open the mouth for an oral exam, we can see your teeth up front, we can see your tongue, but we need to look at the structures in the posterior aspect, your tonsils, your pillars, the uvula that sits back there. But what happens is when people stick out their tongue, the tongue is a muscle and it raises up. So when we ask you to say ah, because of the sound that it makes and the muscles that you have to use, the tongue typically sits down so we can actually see those structures a lot better. If somebody can't do it or doesn't understand it, we use a tongue depressor and you have to fight against the muscle. The muscle of the tongue naturally wants to push against it, so we try not to do that if we don't have to. Question number 3. Why when I eat corn does it look exactly the same coming out?
This corn is raw.
And that's due to the makeup of the corn, meaning it's got cellulose and it's the structure of a plant-based food that is not digestible for us. We can break down different components of the corn. The innards of the corn, or the inside, the juicy part, it's really good for us as well. It's got vitamin B, it's got magnesium, so it's got other things in it that are really good for us. It's just we don't break it fully down. If blood is red, why do my veins look blue? Great question. Let me just first say blood is red in general, but when we look at our arms, we see that the veins look blue. Why is that? And that's because the veins are a more superficial blood vessel, so closer to the skin. And so the skin, the blood vessels, plus the light all make it to where it appears to be blue. And that is quite normal. The range of what the blood vessel could look like on the outside as we're looking at it could be bluish, greenish, even sometimes purplish. It just depends on your individual skin tone that you're starting out with. What color does your veins appear to be? Let me know in the comments. Why does my pee smell weird after eating asparagus? And why does no one talk about it happening with coffee?
What is that smell?
So the acid that asparagus has breaks down into sulfur-containing compounds, which then makes the smell of our urine. While coffee does not have that acid, but it does make your body concentrate it more, accentuating the natural smell of your urine. And if you do both at the same time, not a good combo. What's the difference between a fracture and a broken bone? A fracture and a broken bone are the same terms. We actually use fracture for every broken bone in medicine. We don't say a broken bone, we say a fracture. But then we describe fractures: stress fracture, comminuted fracture, a green stick fracture, an occult fracture. We very rarely use that term that everybody likes to use in media, compound fracture. We don't use that. Depending on the type of fracture, we need to describe it and have the same nomenclature within medicine so that all specialties know what we're talking about. But we very rarely use the word broken. Fracture is a fracture is a fracture. Have any of you ever fractured a bone? Let me know in the comments. Taller people, do they run out of breath faster because air has further to travel? No. Typically, taller people have a proportionately sized system, so it affects their body just as if it was a smaller person. Now, with taller people, there is always the possibility that they might have a little bit more aggressive blood pressures because the blood has further to travel. So you need to squeeze it hard to get it to the rest of the body. But if you're, staying fit, you're cardiovascularly in shape, and you're you're eating well, your blood pressure will be maintained at a good normal level. Do I really need both kidneys? So technically no, but you want both of your kidneys to be functioning perfectly. We've used technology to our advantage now that you can live without them, but you have to be on a machine to filter out your blood to get all the byproducts out and make sure that your electrolytes are staying balanced. That is like a last resort. But people donate their kidneys, right? So they have one kidney, or some people are born with one kidney. Well, as long as you have something that's filtering out your blood, then you're going to be okay. Next question, why can't I tickle myself, but when someone else does it, it's unbearable?
You brought this on yourself. Ticky, 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 ticky.
That's because your brain is super smart. You can't trick your brain. Your brain can anticipate the movements that you're going to do, even to the tickled areas, and so it doesn't tickle as much. Your brain can't predict the movements of somebody else, so that's why you're more hypersensitive to it and you react to it. And typically in areas where you have a high concentration of these specific mechanoreceptors, typically in your feet, your ribs, you're more highly sensitive to those tickle movements. When you hit that thing on my knee, what, why, and how does that test mean I am healthy or not? That is a reflex hammer that we're using. It basically is just checking to make sure that your response to your spinal cord and back is intact. We could test it anywhere you're hitting a tendon, and you can see the reflex. And we grade the reflexes 0 to 4. Do we need to use a hammer? No. But most physicians, they typically have the stethoscope around their necks. You can use the side of the stethoscope bell to just gently tap into the knee. If I drink something and it goes down the wrong pipe, where does it actually go anatomically? So when you swallow fluid or you drink water, it's supposed to go into your esophagus. And what happens is your epiglottis closes and basically blocks your airway so nothing gets into your trachea. But sometimes we drink too fast, or we're talking, or something's happening and the epiglottis doesn't shut fast enough and the liquid gets into our trachea. And you just start coughing up a storm, body's freaking out, trying to get it to go out because it increases the risk of what's called pneumonitis, which then, if it's not treated right away or doesn't go away quickly, increases the risk of getting pneumonia. If you're one of those people who stresses over weird medical questions or health concerns, your body definitely feels it. Stress burns through key nutrients like magnesium and B vitamins, making it harder to relax or even think straight. That's actually why I formulated Chillax with bioavailable magnesium, L-theanine, and saffron. It helps support occasional stress and calms those racing thoughts. Check out Chillax at lifehappens.com or on Amazon. Next question, doctors versus physicians, which are better? All physicians are doctors, but not all doctors are physicians. We'll start with that. This is also a trick question because a physician is a fancy word for a medical doctor. Now, if you have a PhD, you could also be called a doctor as well, but a doctor of medicine could also have a PhD. And that could get confusing to individuals. But just make sure the doctor that you go to for your medical complaints is a medical doctor. Why does my stomach growl? Does that actually mean I'm hungry or just full of air?
Oh, Christ!
Stomach growling has a cool name, borborygmi, yes. So it is the movement of our organ, basically the intestines. They do an action called peristalsing. It's when the food, the gas, and the digestive juices are moving and we get these fun noises. Does it necessarily mean that you're hungry? No, it does not. But if you're hungry and the sounds are getting louder, it could be due to the fact that the organ is actually hollow and echoing a little bit more. So feel free at that point to go ahead and put some food or fluids in your tummy. Why do my feet and hands get wrinkly in water, but the rest of my body doesn't? Your skin is actually shrinking. So cool. And so there's special nerve signals that cause a constriction of the blood vessels. So it, pulls everything in, giving you the wrinkled appearance, allowing us to get grip. So we need it for our hands and our feet. We don't need it for the rest of our body. And that's why it only occurs with our hands and our feet. Why do some people's butts itch so bad at night? What's going on back there? Asking for a friend.
And this itching is tearing my and it keeps getting worse and worse.
No shame. This is actually something that's real, and the medical term is called pruritus ani. And it can be caused for many different reasons. Hygiene issues, there's still poop back there, could have an infection. So if this is happening to you, please don't itch it, and then, make sure that you have good hygiene. If you notice something more persistent, you may have a hemorrhoid that's there that can actually cause pruritus down there as well. Or you get something called pinworms that occur back there that they only come out at nighttime. So have it checked out by a healthcare provider. If I have dandruff and I shave my head, will that cure it? Unfortunately, no. Dandruff is relating to your skin, not necessarily your hair. So treating dandruff is making sure that there's no fungus that is causing that. There are topical things that you can put on there. You have a dandruff shampoo. Also making sure that you have a good balance of your oils as well. So could you treat it faster if your head was shaved? Yes, potentially, but it doesn't guarantee that it's going to go away. So these questions are fantastic, even though somebody might think that they're dumb. They are not dumb. There's no question that is dumb when it comes to healthcare and medicine. If you have any questions that you want me to answer, please leave it in the comments below or send it in an email or a DM. You know how to find me. And as always, do me a favor, binge watch this entire playlist right here and make sure that you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.